Today we are having the interview with the famous reproductive and gynecologist from Georgia, Ketevan Osidze. First, it would be very interesting for our patients to know about your background in reproductive medicine.
I am actually involved in this field 18 years already. We have a residency, especially in reproductive medicine in Georgia, so I did it first as like my first specialty, but of course I was involved in a lot of trainings abroad as guest doctors, international workshops, because it's unbelievable these days to use only textbooks. This is the most developing field actually, and we are really happy that we have all the possibilities for continuous education, not only me, all my doctors. It is our focus to be up to date in everything. Here at Innova Invitro, I'm already third year because it's the newest clinic in Tbilisi, and I can say even biggest for the moment. We opened it as a continuation of this Innova Medical Center project.
You are the director of the IVF clinic in Innova Invitro. How has been your results in these 2-3 years of working?
We started with fresh cycles, frozen cycles, even bring embryos, brought embryos from my old center. They work perfectly, and really results are not unexpectedly, but very good. And again, every time it depends on which age is patient. We are not doing donation as priority. We work with any difficult patients who didn't succeed in other places. And depending on patients, numbers are quite good. Now we don't have single embryo transfer policy, so we can transfer as much as we want or patients want. But of course, we are doing our best to ensure, to explain patients that one good embryo is enough. And again, it's not always donation. If patient is more than 35, 37, a lot of failures, we can transfer 2 embryos, 3 embryos. Our embryology is so transparent, we are giving photo reporting or exact grading, that depending on this, we feel free to be more or less sure what it will be, and we advise each patient individually. But we can transfer, and when it is upper ages, of course, we are transferring 2, just to maximize chance at one transfer.
Invitro Innova is probably the best, or one of the best IVF clinics in Georgia.
We don't want to be best, we just want to be as good as possible.
Yes, but there are one reason for this. Maybe it is the technology, it is the embryos. Can you talk a little bit more about why you have good results? What is the technological advantage of Invitro Innova?
Yes, of course, it is mostly staff, definitely. Because Jordan Garcia, who was the main embryologist, audit of all embryologists of EV Group, which is leader for this moment in research in Europe, where this technology is developing. They are most published group even for this moment. And he was with us from the beginning, but first year he was not working, he was just supervising. Now he is on place, I'm very happy with him, and he is guiding work of other embryologists and Georgian embryologists as well. And of course, when you have enough finances to buy everything what you want, now it gives us really chance of getting better results. It was planned from the beginning as a lab which could do everything which is needed for reproductive purposes. PGS, for example, with laser hatching, all the different, there are small differences between techniques, how they use.
There are some common questions from our patients in relation, for example, to what is better, if it is better fresh embryo transfer or cryo embryo transfer, and what is the pregnancy rate in every case?
Freezing. When it is patient, there are some situations when freezing is very helpful. So it's not harmful, it even gives you more results because it can be slight hyperstimulation, it can be progesterone elevation, it can be little hyperplasia of endometrium because of stimulation. We don't have any doubts. We freeze all embryos because it gives much better results when you are absolutely when you transfer them later. For donation surrogacy, when surrogate mother is separate and donor separate, these moments they don't appear. Maybe only PGS is indications for vitrification. Again, vitrification itself it's not harmful at all. And even if we have some delay in surrogate mother's uterus, which is not corresponding to the day of cycle, or we want it to be more thick endometrium, even for 2-3 days, I advise to freeze embryo because it's not harmful, and the synchrony, because endometrium and embryo development, it's more important. Then,
so you could say that
we feel so sure about our lab. I don't want to extrapolate to all labs that freezing with Ketevan protocol, which is considered the best. Not only embryos, even egg survival is excellent. So we advise to patients very frequently just to freeze all and transfer them later cycles. And for donation surrogacy, it's about indication.
Yes, they should not be worried about it. It's something that gives flexibility without harming the embryos.
No, there are some talks that PGS can be invasive in some cases. Again, there are some PGS techniques how you do biopsy. If you do it with ladder properly after hatching waiting embryo, it's not harmful.
What do you think about what happened recently in China, for example? One doctor genetically modified an embryo to make them resistant to infection, the HIV infection.
Yeah. Actually, I don't like the situation overall because this manipulated with genes techniques is already known, and actually everyone can do it if they want. But in European countries, in America, safety issues are the first. You should undergo you should have a lot of information about safety, and only after that you can apply this because it can be started with only HIV resistance, and it can go to any feature of a person, and any feature, even maybe something height can be connected with something that will be neglected later. So a lot of ethics are involved there, and in Georgia it's not forbidden to make experiments, but you cannot get numbers to have evidence of something. So we don't do any experiments, and I don't like that it's so easy in Asian countries. In some countries where all these researchers now move.
So in definitive, you are against, let's say, the manipulation, genetic manipulation.
Yes,
even if it is theoretically possible to do.
Even if it is safe, I am against. Yes, or it should be controlled, which should be manipulated, which not, and it's not possible to control everything. I think like this for the moment because it's. Too much options there, how it can develop.
Yeah, it is very easy. We don't know what will be the final results. Changing a little bit the focus, we have many cases in which the intended mother wants to have her own child genetically linked to her. But they have to undergo this process of stimulation, and they have many questions about this, usually. So how is the process of stimulation that the intended mother has to undergo in order to, let's say, to pick up later this oocyte?
First of all, to allow couple for IVF, we need to tell them what we are expecting, because it's unfair if you see that patients are very poor prognosis. You should tell them that, okay, maybe your chance of pregnancy is 3-8%, and maybe they change their decision. So it should be blood tests or ultrasound, and ultrasound on the day 3 it is ovarian reserve testing, antibilarian, FSH and ultrafollicle count, which gives us the parameters to tell her how good she is corresponding to her age. First injections are starting briefly processed on the 2nd day of cycle. 4 or 5 days are the same doses, and after that we are checking ultrasound and blood. We see how many are growing, how fast, how the same sizes they are, so it needs individualized protocol to manage everything. And we will consider that all test ones averagely the same diameter. We are giving them final shot for triggering of final maturation. It is sometimes agonist, sometimes other medications, and in 2 days we schedule pickup. And pickup itself is under intravenous anesthesia. They don't feel pain. It can be slight discomfort after procedure. And procedure, it is considered little invasive, not too much, and it can be risk of bleeding. It can be risk of bleeding in case of abnormal location of ovaries or a lot of adhesions in the abdominal cavity. But anyway, when in big clinic, we have a laparoscopy department, so we manage all cases which are extremely rare, so patient will be completely safe here with all this anesthesiologist and all this infrastructure needed. Even for donors, mostly it is hyperstimulation syndrome, which is more or less the really how to say, frequent complication, and even it is only in 2 or 3%.
So you can say, because this is a frequently asked question, that this process, or the main procedure, that is the puncturing, the pickup of oocyte, is not painful, and today, at least with today's technologies, there is very low risk of complications. Yeah. Very, very good.
It is possible even to do without anesthesia. Sometimes patients are asking for it. When we have 1 or 2 eggs, it's not painful. They are mostly afraid of the procedure. For example, in Scandinavian countries, they never do it with even anesthesia. But for us, priority is comfort of patient, because it's completely safe, this anesthetic propofol which we are using, not harmful for egg quality. It's a lot of evidence about this, and why you can do it more calmly when patients is sedated.
I understand. Talking about the stimulation and the puncturing, we were talking about why this is in many cases not possible for intended mothers, being the donor. In general, what are when egg donor is needed? It is because of age, ovarian presence is very low already.
The main parameter is age. Even with good anti-Mullerian, after 43, it's very hard to get pregnancy. And when it's international patients, mostly maybe surrogacy, it's such a routine, quite hard. They prefer trial the once, and after that they switch to donation cycles. And sometimes it is congenital problems. It can be Turner syndrome or something special, which they don't have eggs even when they are young. This is again, or it is some genetical problem there. Sometimes they have some genetical problems which cannot be excluded with PGS. Again, it is egg donation needed. Sometimes, and usually, it's endometriosis, which gives us very bad situation. So uterus is there, ovary after operations, and if it's several operations for endometrioma, usually it's like almost castration, but uterus is good, so you can give estrogen, progesterone, cyclic processes in uterus are good. These ladies can undergo just donation. And Georgia is great for this because it's not anonymous. Even if we want, the patient can and should choose the donor, and they will like phenotype, education, everything what they want, they can know. So it gives them more easy decision to use egg donors.
Do you recommend to young ladies to freeze their own oocytes for the future as a kind of insurance? Would you recommend this to young ladies today?
Yes, a good question, because I would recommend it to young ladies and not the ladies after 37. When consulting patients, and it's worldwide, not only in Georgia, it was believed that, okay, I'm getting 40, I don't have husband, I don't want to be single mother. Like an option, they were freezing eggs. It's not a good idea, because when you freeze eggs, you feel more calm, you are not getting married spontaneously, everything is delayed, and finally you cannot reverse everything. And really good results comes out only when eggs are young. So in case you are not sure if your career is better for you or life circumstances, And if you are thinking about it, better to do it as young as possible. But their second question, maybe you don't need it in the future. So it's very popular, it's very good, with good new protocols. It's very good results later, but again, it's quite dependent on the patient.
What make a woman a good donor? What make her a good surrogate? Which factors are important? And what is better that the intended parents select these donors or surrogates, or that the king select donors and surrogates?
We can choose. For patients, mostly appearance is like most needed one, but if they listen to us, it will be better.
Of course, I understand. So it is very important not to
emphasize only the height and the blood, eyes and everything. Again, blood group, it doesn't matter because it can be different from mothers, it can be different for surrogate mothers. In nature, it's even better. When it's too much connections between the parents, it's bad sometimes, yes. So different genotype, it's better. But for surrogate mothers, it should be, again, weight is very important, not to have the surrogate mother, her medical history, her livers, how it was with her own children, how many times, not more than 2 cesareans, but 2 cesareans, if scar on the side is okay, it's absolutely normal, and at least in Georgia it was quite frequent when it was cesareans. Now it's less, but we allow the surrogate mothers. Again, infections, everything, thyroid function, glucose levels, everything is checked.
In which cases are IVF recommended?
Necessary it is when it is upper age patient, at least to see if this embryo is worth to transfer or not to lose time, and if it's not good embryo, just to continue with new stimulation, because first of all it can be failure when you transfer, and second it can be miscarriage, so this lady is losing several months before possibility to start new cycle. But even here it's not indicator that it will be all time such bad or such good, because any embryo has its chance of having good or bad, and it's not repetitively the same. For Georgia, we are mostly just transferring because it's costly, it's the money issue. But when it's international patient and if should be transferred to surrogate mother, it gives you chance to avoid such many other costs, so better to check everything.
Exactly.
I see it like this, it's not only medical background, but we are evaluating.
There is something you specifically, especially remember, something funny or unusual in your life experience that you'd like to share with us, something that touched you?
Once it was, I knew that it was cesarean section and patients should go home, but I see they with these newborns before they came. Again, they bring another embryos from my old clinic here the same day before she came home. So from maternity house she came here, not home. Like she said, I feel here like home and I want you to care about these ones. And finally these embryos are already twins, 2 boys. So I'm really happy to see this family, these people coming, because anytime it's very individual experience. It's not only the number of cycle in the year. We know all of them and we follow all the baby, even international patients. They just give us a sperm. Doctor, you know how to do it. So when they are coming back, we are already with children. Sometimes it's more than 1 year. They are in the sea. It's pleasant and really touching. It gives us enthusiasm to work.
Would you like to tell some final words to our patient?
It's great pleasure to be involved in everything, because we are not doctors who are curing something. We are really making life-changing things for them, and we feel very enthusiastic and very happy for any patient, and especially international patients who has such a big problem that they need us. We feel very, very big responsibility and follow each case individually. I just want to tell them that they are welcome to come, and I hope every patient who will come will be happy.
Thank you so much again
being with us today.